it's hard to develop that self-esteem when you put on this mask that a lot of us have to. And essentially, all the world's a play, I believe, as Shakespeare once said. And you feel like you have to be this person in order to be accepted. But as you become that more authentic self, and you are embracing and you get that confidence that comes from being your authentic self, you're feeling better about yourself, you're eating more healthfully, that's when you can really move the needle in terms of, feeling good about yourself, but then also helping others along the way too. And I think that really that's the thing that I love most about what it is that we do here on the show. And I'm sure you as a physician helping other people, like there's no greater joy in life than helping somebody else shed that weight, shed that mask, and then live their best life, so to speak.
Right. It's why I became a doctor, because it's fun having a person never have headaches again. When they have chronic headaches, you tell them, look, I can really save your life and the ability, you don't take drugs the rest of your life. You'll never have a headache again. This is what you have to do. When a person has psoriasis, psoriatic arthritis, lupus nephritis, we're talking about these diseases that can recover. And I learned that nutritional excellence is therapeutically powerful. In other words, let me say this, that to maximize a nutritional portfolio or a dietary portfolio that can maximally slow aging and extend human lifespan is also therapeutically effective when applied to certain disease states. And when people are suffering with chronic disease and they go to a doctor and all they get are drugs you have to take for the rest of your life, and this concept that diseases are genetic or permanent or the consequence of aging and you can never get well from them. So people are given such a negative and hopeless prognosis for their conditions, and they're never told the option that they can make a complete recovery if they change their diet and if they do this nutritionally. And I always thought that, well, look, every person won't want this because some people are so addicted and so indoctrinated into their foods. But there are so many people that would choose this route if somebody told them that there was a way they could get well and completely recover from their rheumatoid arthritis or from their psoriasis or from their eczema or from their chronic headache syndrome or from their lupus nephritis. Or people die of lupus. They get kidney transplants. And who told them that they could have gotten totally well if they could change the way they eat? Who gave them that option to at least make a choice? No choice, put them right through a kidney transplant. Yeah. I have a patient who was, she was a 16-year-old girl who was on the national renal transplant list waiting for a new kidney with her lupus and lupus nephritis. And she made a complete recovery, went from a creatinine of 4.2 to 0.8, which is, wow, right. Completely cured your lupus. Off all drugs now, and you're well for the rest of your life. You live a normal life. And she was headed for a kidney transplant. Once you do a kidney transplant, you're on immunosuppressive drugs the rest of your life, so your body doesn't reject the kidney. You're going to be on steroids, and it's never, and people die of lupus. There was one case where, again, a young girl, she was in the hospital in Boston. I won't name the name of the hospital. And the parents had heard about my work, read about my work, and she was actually deteriorating under medical care in this famous Boston hospital. And the parents wanted to take her out and bring her to come to see me and see if I could help her. And I said, yes, putting her under my care. I could wean. I'm not going to stop all her drugs. We can wean off slowly once she improves her nutrition sufficiently. It'll take some time, but we can possibly get her well. And then they put security guards, policemen, in front of her door. The parents were unable to take the child out of the hospital because the medical profession can say, for the benefit of this child, we can't let her parents take control because we need to treat her medically. And this happens very frequently. It's not like it's a strange situation. So the parents took her to court. And by the way, the child passed away in the hospital. She died in the hospital. The parents took her to court. I'm saying that so people don't get too shocked at the end. And I presented all the cases of lupus I had presented that reversed their condition and showed and how it works and why it works. And I showed the blood tests and the cases and the people actually testifying. The other lupus sufferers that got well testifying, and the judge ruled in our favor to be able to take the child out of the hospital under my care. And then the time they went to get her to bring her over to to New Jersey, she had passed away in the hospital. Yeah.
Have you published any of these case studies? Forgive me if you have. I haven't seen them.
I published some of them in a series of case studies.
We'll link off to those down below in the show description and then the episode notes. I'm sure that's going to get a lot of people to open up. I can't imagine how infuriating That must have been for the parents. I can't even imagine that level of pain and the frustration. And I would imagine there was a great deal of that for you as the physician as well. Like, why aren't these other physicians listening right now?
Yes.
Yeah.
And I think that's why I got into writing books about this, because I felt like, I know that this works, but I have to write. But the other doctors, they're making they're not understanding that this is a science-based system and how it works. And at least if they've given me this degree of false attacks and false criticism, they should know really what I'm saying, what I stand for. Put it in a book, show the references, so at least when they're being critical or saying something, at least they know they're being critical of what's written in paper that I'm really saying, not something made up that I, you know what I mean? So it's like back then in the 20, 30 years ago, I wanted to make sure that I could spend at night doing a lot of writing and put down what I'm doing in the results, in book form.
Do you feel like if that patient were to, or if that were to have happened today, there would have been a different outcome? It wouldn't necessarily have been this great litigious battle?
No. There are security guards and law officers in front of, commonly when parents want to remove their child from medical care when the hospital, so no, I don't think it may not have been different today.
That's tragic.
Yeah.
That's absolutely tragic. That's very tragic.